Hi, happy morning, everyone. Welcome to Metier E2 channel. I hope you're all fine and preparing well for your upcoming exams. So daily we are posting 5 important MCQ for the nursing competitive exams. Okay, we'll start today's session with a small quote. Passing the exam is a simple two steps process. What is that? Believe in yourself and back it up with the hard work. That's it. So this is a simple two-step process. Okay. ஒரு காம்படிட்டிவ் எக்ஸாம் பாஸ் ஆகிறதுக்கு ரெண்டு ஸ்டெப் இருந்தால் போதும். மெயினாக உங்களை நீங்கள் நம்பணும், அதுக்கான ஹார்ட் ஒர்க்கு போகணும். தட்ஸ் ஆல். ஓகே, வில் ஸ்டார்ட் டுடே செஷன். டுடே வி ஆர் கோயிங் டு சி infection control. Okay, infection control related questions we are going to see. So first question, which of the following is not a sign of systemic infection? Okay, the options: fever, aching and weakness, redness and swelling, nausea and vomiting. So what is the not a sign of systemic infection? So two keywords we have to see here. What are the keywords here? Not a and a sign of systemic infection. So what is the correct option? The correct option is redness and swelling. Okay, redness, swelling. So why it is not comes under systemic infection? It is a local infection, means the redness, swelling will come. So remaining fever, aching and weakness, nausea and vomiting. These are the signs of systemic infection. You should know the difference between the local infection as well as the systemic infection. So if it is a local infection, the heat, redness and inflammation to the particular area or particular part, only the redness, inflammation and the swelling will be there. When compared to the systemic infection, the generalized pyrexia, generalized malaise, the induration and redness greater than the 2 centimeter. Okay, so this is the main differentiation between the local infection and systemic infection. Clear? Yes. Next question. How many links of the chain of infections are required to occur together to cause infection? 1, 3, 4, 6. So correct option is option 6. So you are all aware of the chain of infections. In previous class, we have discussed about this chain of infection. You can see the previous videos of our Metier Academy's YouTube video, so that we have explained detailedly about the chain of infections. So what are they? Infectious agents, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. So all these are the 6 chain of infections. So we have to cut down anywhere if it is possible to cut down the chain of infections. Okay, so the answer is option D6. Next question. The class of relationship where one organism benefits from another without affecting it is known as what? Okay, once again I'll read the question. The class of relationship where one organism benefits from another without affecting it is known as. Question புரிஞ்சுங்களா? ஒரு ஆர்கானிசம் நம்ம பாடியில இருக்கு. For example, some organism is present in our body. Okay, it getting the benefits without harming our body. It is called what? So the options they have given: pathogenesis, commensalism, symbiosis and mutualism. Symbiosis and mutualism. So the correct option is answer B, commensalism. So what is meant by commensalism? It's a type of biological interaction where one organism benefits while the other is not harmed or helped. For example, in our body, in skin, we have Staphylococcus aureus, right? So that Staphylococcus aureus getting benefits from us, right? So we are not getting any help from the Staphylococcus aureus, but it may harm our body. So it is called commensalism. Same like in our guts also we have some lactobacillus, right? It is getting benefits, right? Yes. So what is meant by pathogenesis? Option A. Pathogenesis means when the infection become a disease, it is called pathogenesis. Clear? That is option A, right? What is symbiosis and mutualism? The similar, both are symbiosis and mutualism is both are same only. So what is happening here? Both the organism and the host getting the benefits. Both are mutually getting the benefits. It is called symbiosis. Clear? You should know the difference between the commensalism and the symbiosis. Commensalism, only the organism is getting the benefit, not the host. But in the symbiosis, mutually both the host as well as organism getting the benefits. Clear? Here the answer is commensalism. Next question. Which of the following is not a part of standard infection control precaution practice? Which of the following is not part of standard infection control practice? So the keyword is not, because most of the exams of the not question, okay, definitely will be there. So when you read the question, read it continuously and carefully. That is very, very, very important. So the options they have given: placing a patient in an isolation room. Option B, washing hands with soap and water. Option C, disposing of sharps in a sharps container. Option D, managing a blood or body fluid spillage. So what is the correct option? Option A, placing a patient is in an isolation room. Why? Because it is not a standard precaution practice. Okay, option A is not comes under standard precaution. It is comes under either a contact precaution. Because when will you provide isolation? Whether maybe a patient may be immunocompromised or a patient may be a very infective person. Okay, but B, C, D remaining options and all we will carry out throughout any procedures in the hospitals. What are they? Performing the hand hygiene, using the PPE, proper respiratory cough etiquettes, and using antiseptic techniques. So these and all comes under standard precautions. Whereas the isolation, placing the isolation rooms comes under a specific precautions, maybe a contact or a droplet or airborne, reverse isolation. Okay. So it is not comes under a standard infection control precaution. Next question. What type of precautions are required when managing an infectious patient? What type of precautions are required when managing an infectious patient? Options: standard infection control precaution, transmission-based precaution. Option C, standard infection control precaution and transmission-based precaution, and no precautions. So the answer is option C. So when the patient is infectious, we need to follow the standard infection control precaution. The standard infection control precaution is common for all the persons, whether the patient is infectious or not infectious. Okay. So that is option C, standard infection control as well as transmission-based precaution. So we should always cut down the infectious chain. So transmission also we have to, transmission-based precaution also we have to maintain it. So when there is an infection, we have to follow both the infection control precautions. What are they? Standard infection and transmission-based precautions. Clear? So here for this question, I think no need of any explanations. It's everyone understand this question number 5. I hope today's class was helpful for you. Please do revision. Okay. And please kindly subscribe our channel and press the bell icon so that you will get an update of our classes. Okay. Thank you all. Meet you in the next class. Thank you so much.